All right, Paul Hefty here with 492W. I want to start out with looking at some health insurance info to get us started, and then looking specifically at health law introduction there so that we start to understand these two pieces in the health industry, how it impacts us as a business. But more importantly, you'll see this is something you'll consistently do with your CPD research sharing on the discussion boards. We'll take different topics and then you'll look at finding different information so that by the end of the course, hopefully you have a good understanding of health law and how health insurance impacts your business in the health industry. All right, so first thing we're going to do here with Healthcare 101, these are some three things you just got to do here because again, it'll set you up for success for the rest of the course. First, we'll talk about what the difference is between Medicare and Medicaid. Then there's two videos you have to watch. First one is just, again, they're short. It's a health insurance facts video, 5 minutes. And then there's a Obamacare, which is health law, facts video for 7 minutes. Make sure you do those. They're on Canvas right there for you to view. So first off, Medicare. Think of it as you're caring medically for U.S. citizens 65 years of age or older. So this is a federal program, completely run by our federal government, and it's attached to Social Security. It also covers people with disabilities, so it's available regardless of your income, no part of that. There's 4 parts here: hospital coverage, your medical insurance, purchasing supplemental insurance for different services, and then real key is prescription drug coverage. So there's an article down here on the bottom or a link you can click here. You can pause and click. That'll give you more information, but real simple. Medicare, again, the key components, it's a federal program and it's for citizens 65 or older. Medicaid, then think of this now, this is medical aid. Again, this is the difference now. This is a 50-50 supported program. 50%, half of it by the federal government, and then half by the specific state that's involved here. This is for low-income individuals and families. Again, it's a 50-50 split. So what happens here then, each of these can have a different standards for who qualifies and who doesn't within the states, because there's one for each state. So you want to go ahead again, click on the pause here, click on the link. It'll get into the specifics. Where this impacts you with your business design is if you're dealing with clients 65 years and older, most of their payments for services and product is going to be through Medicare. And if you're dealing with people that qualify for Medicaid, then you're going to be dealing with that in your billing and collecting of revenue. So again, you're going to work together here, understand the two. Medicare, 65 and older, one program run by the federal government. Medicaid, again, people that are with low income. And again, there's 50 different programs because it's half of it's through the federal government, but then each of the 50 states has their own requirements. So wherever you design your business, that state, you'll need to know what those requirements are. All right, health insurance information. What we want to do is go through this real quick, watch the video. It's actually right on Canvas, so you can go ahead. It's kind of goofy, but it's from a great resource called the Kaiser Family Foundation. You want to make a note here. This is a very credible research or resource because it's nonpartisan, and again, it will not have a bias politically. It's a big point in the class. You can have your political beliefs, obviously, because it's your business, but again, we want to be non-political in the way we express research so there aren't biases in the way we're doing it. So watch the video 5 minutes, take some notes on that, and then I'll go through with some key points later on in a different lecture. Key point here with the health plans is real simple, is that there's different types here, and this is the way they describe them. The better the plan, being a platinum, then the more expensive it is. So you're going to get 90% of everything covered, but you're going to actually, the plan's going to cost a lot more. Great example is by working for the university here at Penn State, my health plan is really a great health plan, but it costs a little more. But again, it's worth it, again, for a family plan. Again, you can see then the next one will go down to gold, silver, bronze, and then less than 60%. Once you get under that, again, this is what you as younger people quite often do. You're going to feel you're a little healthier. You're going to go ahead, don't want to have to spend a lot on monthly fees for insurance because you don't plan on using it as much. The problem is if you do have a major health problem, then you're going to have to pay more on the back end. So you can see with a platinum plan, I can budget pretty much my out-of-pocket maximum each year is not going to go over that, where with a catastrophic plan, you could all of a sudden find yourself with a large bill with an unexpected health problem. Some of the goals of the Affordable Care Act or current health law was to basically put some reforms in place. Number one, it was to drive down the number of Americans without health insurance. Up until the Affordable Care Act came into play in 2014, 2015, you were not required to have health insurance. What this impacts is people that don't have health insurance and then are going to the emergency and health services. That money's got to come from somewhere since they're not paying for it. So it would come out of taxpayers or other costs and fees that the hospitals or these care facilities have to make in their services. So the idea is if we have more people with health insurance, then we could actually drive down the cost overall for Americans when we do medical services. The other part is it's about being proactive in your health plans. So if you'll see a lot of insurance plans will actually pay full fees for regular checks throughout the year. And that the idea is if we're doing that, then we're healthier and there's less problems and we'll improve our health outcomes. And then last, just the same thing again. If we're healthier, then we're spending, there's less fees for services for healthcare, and that could overall bring down costs. That was the idea behind it, or the goals. So then again, to learn a little bit about what this involved, you want to look at this Obamacare facts video. It's still used today with the federal government. Again, this was shown July 17, 2013, because then starting in 2014, we started to make these changes. Again, it's through the Kaiser Family Foundation, which again is a very credible resource you want to use as you start to look at this link of the Kaiser Foundation as you start to do healthcare or health law research. So go ahead and look at this video. Again, take some key notes and we'll discuss some of the key points again later on. So quick here, just to look at some of the pros and cons since this has been in place, the Obamacare. The pros, it has shown to slow the rise of healthcare costs. It covered a ton more benefits than we did before. A key point was a pre-existing condition. Prior to Obamacare, if you had a pre-existing health problem, a good example is to say you had cancer and then you changed companies or wanted to change insurance. Insurance companies at that time, because it was pre-existing before they took you on as a client, they didn't have to accept you. And you could find yourself without insurance. Now, insurance companies do have to take on that pre-existing condition and give you coverage. Again, children then also you'll see you can stay longer now on your health insurance plans, which is key for you guys in college right now. Some of the cons, the negatives, it did raise the income tax rate. The Affordable Care Act taxed those who didn't purchase insurance. Again, you were required by the individual mandate to do that, so it did tax those who didn't. You can see then what people did, especially young people, is chose just not to pay, to go ahead and pay the tax rather than pay for the coverage because it costs more. So there was a flaw there in the system. And then pharmaceutical companies had to pay extra for closing what's called the donut hole gap. in the payment and fees and services for pharmaceuticals, drugs, and so forth, which is a big issue. So again, these are all issues that continually trying to work on and make improvements on, but you can see some of the positives also established. So a couple workshops here to finish up after we've looked at this. I want you to write down, what impact do you think the Affordable Care Act has had on the health industry overall? And then specifically, how it may impact the design of your business, okay? And then last, now that it's 2020, we have to look at what are some future impacts or considerations that has on businesses now as the health industry goes forward. So pause here, just write down, there's no right or wrong. If you don't have a good answer, just write some ideas of what you need to research. That's the other way to think of it. When I ask questions like this, these are things you're going to have to address in your projects. So these are ways to give you pointers for success. So some CPD research sharing considerations. We get into our first one here. You're going to talk about leadership and organization or business design. Think about connecting it to the article we reviewed, The Economist, where the leadership is for all and not just a few. So again, your challenge is to create a business, in particular in the current financial system and with the current health issues we're dealing with, for the greater good rather than just a few people. With CPD number 2, the subject here is recruitment of staff and training of your staff. Think about how health law educated or had to inform people in the industry, just like we used with the videos. Think of ways you would need to educate and inform yourself on health law that's going to impact the clients you're working with or the services you're providing. And again, don't look at just what is in the past or the present, but start to make predictions of the future. CPD number 3, research sharing. The topics here is now managing that staff performance after you've trained them, and then looking at a compensation program for them. Again, think of how health law monitored and assessed how we can monitor and assess the health knowledge of our staff after you've tried to do your training. Again, you want to also look at ways you can reward or in your compensation program using health law or health insurance or health benefits. Again, what are they? And then last, you can use the example of what the Affordable Care Act uses as a reward system to motivate people, kind of like a compensation program, to not only get insurance, but then get more involved in the process and educate themselves about how to be proactive and healthier overall. CPD number 4. This is where we start to get into marketing of your business and trying to increase sales. One way you can look at this is, what did health law or the Affordable Care Act, what were ways the government tried to market this new system? Because they had to educate, but they also had to motivate people to want to learn about it. And again, is the Affordable Care Act, is it actually increasing the number of people insurance? So look at some data here and get some hardcore information. This would be a correlation to increasing sales. So they needed to increase the number of people that were taking on insurance. Did they actually do that? And what impact has that had overall? CPD number 5. We're going to talk about, this isn't a topic in the textbook, but you need to look at certifications in the health industry. This is that benchmarking I'm talking about. What are some of the industry standards? And how did the Affordable Care Act impact these standards? Specifically looking at certifications or requirements in the field, in the health industry of the business you are designing. And then what changes have occurred because of the Affordable Care Act? Great example, and the one that had the biggest impact was the pre-existing condition. What are some other ones there? These would be ideas of certifications or changes in the health industry. All right, last then, the rest of the slides here, I won't go into detail with, but these are just different resources for you, links to help you do your research on health law as we do the discussions throughout the course. Thanks.